When it comes to appearances, you wouldn't say humans have much in common with these guys. But when it comes to going to the doctor, we actually have way more in common than you might think.
They may not hang around in waiting rooms playing on their phones or get days off school, but snakes do need a little TLC from the right kind of dog. And for this snake, it's veterinarian Dr. Bob, who knows all about the ins and outs of reptiles.
Alright, now obviously I'm no snake expert or expert on any veterinary matters really, so how do you tell just looking at them when they're sick? Because she looks fine to me.
Well, they're very good at hiding signs of illness, so it can be very difficult to pick up that they're unwell. So what we look for is subtle changes, things like a loss of appetite, and a reluctance to move around, or even just changes in behaviour. In her case, when she was sick, she became very aggressive, which she wasn't normally like that. And what we found was that she actually had a form of constipation in her cloaca.
What exactly is the old cloaca?
The cloaca is a common chamber for the bowel and the kidneys and the reproductive tract.
Cool, alright, now you and Gary have got a lot set up and going on here. What are we about to get into?
Well, the plan today is to anaesthetise her so that we can then use an endoscope to look into her cloaca and see how much scarring is there. And then once we're satisfied that's healing well, we're going to ultrasound her so that we can have a look to make sure that there is no reproductive activity, or if there is, we'll have to make a decision as to what we're going to do about it.
Alright, well let's get her prepped and get her on the table, hey?
Yep. Because they've got such low blood pressure and a slow heart rate, they don't go to sleep as fast as a dog or a cat would.
Yep. Oh, look at that, you can just open her right up and have a good look.
So come around.
Oh yeah, just he's more important.
That opening and closing is the glottis, the entry to her airways. And we're going to place a tube down there so that we can control her breathing.
Okay, so very much like anything else having surgery, you've got to keep the lungs moving. There we go. So where's the heart approximately?
It's about a third of the way down the body. That's
Whoa! That's awesome.
Next thing is we're going to use an endoscope to look into her cloaca and see how much scarring is in there. We go in through the opening into the cloaca called the vent.
Yep.
And we then inflate it with water so that we can actually see what's happening in there.
There you go, look, quite clear. That's like a good colour on the lining, like the walls of the...
Yeah, no, that's a very normal colour. And certainly the cloaca itself is looking very healthy.
Awesome.
With the endoscope showing good results, it's time for the ultrasound. And surprise, surprise, snake ultrasounds aren't that different from humans.
Well, what's the purpose of the water?
The water creates good contact between the probe and the snake's skin, because if you have air in between them, it interferes with the image.
Okay, so it substitutes for gel, what you normally use on humans.
Yep. Because these guys have got scales rather than skin like people.
Yep.
We find that the gel doesn't do a good enough job.
What's the result having seen inside and outside?
We know that she's reproductively active and she's producing follicles. There aren't any eggs there yet, but we're still not sure whether her oviduct has connected back to the cloaca. And this is unfortunately going to be a case where we'll have to wait and see.
But generally she's looking healthy and well.
She's looking very well. We're really, really happy with her.
Great work, team.
Our slithery patient is off to the recovery room, where she'll be monitored before being returned to a more snaky environment to feel more at home.